Well, welcome to Area 4 of the Global Quest for Health and Wellness. I'm Dr. Ian Dowbiggin of the History Department, and I'll be talking today about the history of this global quest. And I've subtitled the talk, Limits to Medicine, for reasons I think which will become obvious as we go along. Now, here's a question to get us all warmed up for today's lecture. Who is this person? Well, if you don't know who it is, at least this photo of this particular person, I'm sure you'll recognize him in this photo. He's the fellow on the right, and of course he is the comedian Dana Carvey. Now Dana Carvey in 1998 was desperate to relieve his chest pain from angina, and he underwent a double bypass operation. But 2 months later, he was still suffering from chest pains, and he learned his cardiac surgeon had bypassed the wrong blood vessel. So Carvey went ahead and sued the surgeon for $7.5 million. But the real news was that this case, his case, Dana Carvey's case, was only one of literally thousands of medical mistakes made every year. Studies show that as many as 10,000 Canadians die every year of preventable mistakes by doctors, nurses, or other healthcare workers. And in the U.S., understandably, the human toll from medical errors is as much as 100,000 deaths per year. So that's a point I want to make right off the bat in this lecture, and that is that a lot of medicine today literally can make you sick, okay? Another anecdote I want to look at as a way of getting started in this lecture. This is a photograph of what was going on in the Los Angeles Forum back in 2009. A Tennessee-based organization which offers free mobile healthcare services announced that it would be there at the forum to provide 8 days of care. Well, even the people who ran this organization were astounded at the turnout during those 8 days. In fact, many showed up the first couple of days and they had to be turned back. They lined up to get new teeth, for example, but also for blood pressure checks, mammograms, immunizations, and pap smears. Now, what does this snapshot of the current healthcare system show? Well, I think it shows that there's a mammoth, growing, and virtually insatiable demand for healthcare in the modern era. Of course, you could say that the reason there was such a huge turnout was because a lot of these folks didn't have health insurance of any kind, and that's a real problem in the United States in this day and age. They don't have universal healthcare coverage, at least they didn't until very, very recently. And so you could help to account for the huge turnout by saying that these people simply didn't have any health insurance and they were postponing seeing a doctor until then. I don't think it accounts for the huge turnout. And so I would say that the Dana Carvey and the Los Angeles Forum incidents are reflective of two things. First, that the outset of our new millennium, our healthcare system increasingly fails us. And the second lesson is that the industrial world is, and I use the word addicted to medicine, and I use that word purposely for reasons we'll see in a minute. So these are the points I want to establish right off the bat before we get into the history. Medicine, modern medicine today, makes us sick. Number two, we are addicted to medicine as technology. And when I say we're addicted, again, I use the word purposely because when you talk about somebody, for example, an addict being addicted to drugs, the addict himself doesn't love the pusher of the drugs, nor does he love the drugs, okay? But he can't help himself. And this, I think, sort of characterizes the condition of modern medicine today, that we are addicted, even though we know, in many cases, that it's not good for us, and we don't particularly admire or respect the healthcare providers providing us with that level of care, we still can't help ourselves. And that's what I mean by the term addicted to medicine. Third thing I want to talk about in this lecture today is that, and I would argue, that we live in a culture of what I would call therapism. And without going into too much detail as to what I mean by therapism, I would say that therapism refers to the dependence that we feel as on a day-to-day basis, as a taken-for-granted experience, a dependence on the sciences, particularly medical science, to enable us just to get through our daily lives. And this is a radical change, I would argue, from that of, say, half a century ago, where, as late as half a century ago, where people, where the culture of therapism was just beginning, but people didn't feel that they had to resort to medical terms, medical services, medical help to help them adapt to the everyday problems of existence. The fourth point I'll make, main point I'll make in this lecture is that it's very hard for us in this day and age for us to see outside the paradigm. And by that I mean it's very hard for us to actually step outside this current crisis of healthcare, see it for what it is, and actually recover or achieve the political will to do something about it. And that's what I mean by saying, when I say it's hard to see outside the paradigm. We're so compromised in a sense, consciously as well as subconsciously, that we can't step outside and see the problem for what it really is. So, the question is, how did we get here? How did we get how does history explain how we reached this particular juncture in history? And I'd like to go back to the late 18th century, and I'd like to talk about what health and healthcare was like at that period of time, because I think we can get a much better idea of where we are today when we understand how radically different things were back then. I'd go back to the times of this fellow, Thomas Malthus. Malthus was a British economist back in the late 18th century, and he came up with what's now widely acknowledged to be the Malthusian law. And Malthus's law essentially says that population tends to outstrip food supply, and that famine, disease, sicknesses, and other, what he called, positive checks affect humankind when population growth exceeds food supply. Malthus stressed that human history up to his time, the late 18th century, had been unable to escape from this law of population, and among other things had affected human health insofar as it had produced high birth and death rates, and these were very obvious facts of life for all of humankind up to the 18th century. Well, just as Malthus was making this point, history was beginning to change dramatically in the 18th century as far as the history of health and healthcare is concerned. Standards of living began to improve, and a lot of it was due to the introduction of some very basic agricultural reforms, including this very familiar crop, the potato. And it was, of course, introduced from the Americas to Europe, and because it was so easy to grow and it was so plentiful, it helped to boost population by the early 1800s and improve the nutritional intake of millions, literally millions, of Europeans. Just to give you an idea of the effect on population of the humble potato, between 1800 and 1840, Ireland's population increased from 2 to 8 million people, largely due to the introduction, as I say, of the potato as an elementary foodstuff. As population increased, you got more and more people leaving the countryside, moving into the cities, where living conditions, as this picture conveys, living conditions were subpar. They were unhealthy, and this illustration also points to a real problem characterizing health and everyday existence in many of the Western world cities in the early 1800s, and well, actually into the late 1800s. This shows a typical backyard in an urban setting, and it shows, for example, an outdoor latrine. It shows cesspools, the presence of animals, and again, this illustration points to the fact that standards of health were extremely low in urban industrial settings. This, of course, had been during the time of the Industrial Revolution of the 19th century. And so this would lead to tremendous problems in public health. And during the 19th century, because of the increasing urbanization and industrialization of the population in Europe as well as here in North America, the infamous killer diseases of the 19th century surfaced. This is an illustration depicting the coming of cholera, one of these terrible killer diseases. This disease originated in India, and hence the great concern that's conveyed in this illustration, this great concern that cholera arrives in ships from other parts of the world. And you can see in the illustration, there's a little rowboat meeting the ship, trying to obviously keep it from docking, and it says Board of Health. And it shows again that not only were urban populations and their governments becoming alarmed at the prospect of cholera arriving on their shores in the 19th century, but also that urban governments were taking their first basic steps towards public health in the way of forming boards of health. But cholera wasn't alone. There were many other killer diseases of the 19th century which, depending on the locale, depending on the time, could exact a fearsome toll on populations. For example, in a matter of mere months, you would have thousands and thousands of people dying from these diseases, and not just cholera. Tuberculosis was a tremendous killer disease of the 19th century. There was typhoid. There was diphtheria, and a whole host of other killer diseases. And so this was the prospect facing human health by the middle of the 19th century. These epidemic diseases were ravaging Europe and North America's landscape, including its main cities. Now, what arose in reaction, and this is an important point, what rose in reaction to the high incidence of these terrible diseases was the growth of the public health movement beginning in the 1830s and 1840s. Again, because of the tremendous toll that these killer diseases were exacting on human health. This photograph refers to the spot where Dr. John Snow had discovered in 1854 that cholera, the bacillus that's responsible for cholera, is conveyed by water, and that all you have to do is maintain running water, provide running water for urban populations, and you can dramatically cut the rate of cholera. Cholera bacilli breed in stagnant, still pools of water. And of course, cities were full of these in the 19th century, including wells, where people would come to get water for drinking purposes, for cooking purposes, for washing purposes. And Dr. John Snow knew nothing about the bacillus responsible for cholera. He wasn't an experimental scientist, but he noticed that the rates of cholera were highest in neighborhoods in London, especially around this particular pump. And by simply improving the pump, he was able to reduce, again, the incidence of cholera, which points to a very important point about public health and the public health movement. And that is, long before the rise of bacteriology, the science which establishes the microorganisms which are responsible for these killer diseases, long before then, people were making the association between, for example, impure water, unhealthy homes, lack of garbage, municipal garbage pickup, laws governing occupational safety, the quality of food and drugs. People were making the association between these factors and these killer diseases. In other words, you didn't have to be an experimental scientist. You didn't have to be a researcher to notice that there was this interesting statistical correlation. So where you got crowding, for example, and where you got crowding and you had filth in the streets and you had bad occupational conditions, there you usually found that these diseases were at their worst. So the point is, the public health movement, although it featured some licensed doctors in its early years, was also staffed by lay people, unlicensed doctors. And these were people who very often took leadership roles in the public health movement. And so it didn't take a medical license to establish, to see these kinds of links with public health. Now, because of these important steps taken by these public health reformers, again, improving housing, improving occupational safety, improving food quality, improving water quality, once they started taking these important steps, lo and behold, the incidence of these diseases began to fall, and fall precipitously for the rest of the 19th century. And I'll revisit this point later, but it's worthwhile making right now. This is well before organized medicine produced vaccines for these diseases to cure them. In other words, the public health movement was making seriously successful inroads on these killer diseases long before medical science produced effective cures for these. Okay? And this is an important point. And so you could say that by the end of the 19th century, the public health movement had racked up some very, very impressive successes. The overall level of health was increasing, was improving. It was also coincided with, again, improvements in food supply, the transportation of foods, and so on. This was a time, by the end of the 19th century, people could realistically hope to enjoy longer lives than their ancestors and lives of better quality. For the first time in history, in all of history. And much of this success, again, was due, most of this success, I should say, most of this success was due to the public health movement. Now, what was happening at the same time over the course of the 19th century? Well, over the course of the 19th century, we were seeing the rise of organized medicine. The rise of organized medicine in terms of modern-day hospitals, or recognizably modern-day hospitals, professional organizations, professional journals, setting up of licensing boards, medical schools, impressive discoveries in the field of experimental medicine. At the beginning of the 19th century, you could say that the medical marketplace was extremely crowded and that licensed physicians did not enjoy the kind of monopolistic privileges that they enjoyed at the end of the 19th century, and indeed that they enjoy at this particular time. There was all kinds of amateur herbalists, there were midwives, There were patent medicine peddlers, barber surgeons. So the medical marketplace was extremely crowded, and it was very, very competitive at the beginning of the 19th century. And that's in stark contrast, if I can just jump ahead, it's in stark contrast to the situation at the beginning of the 20th century when organized medicine largely enjoyed monopolistic privileges over all their rivals in the medical marketplace. So, but again, organized medicine starts from her humble beginnings in the early 19th century. Many of the first strides towards modern organized medicine occurred during the French Revolution, when the French Revolution swept aside many of the old institutions that related to the Ancien Regime, the absolute monarchy that governed France in the 18th century. Well, the French Revolution swept away a lot of political institutions associated with the royalist regime, but it also swept away a lot of the medical institutions. So, in other words, the French Revolution wasn't just a political revolution, it was a medical revolution. And this picture here helps to tell you a great deal about the new ways that the French Revolution spawned a new kind of professional medicine with a new clinical approach. This features the very famous French physician René Laennec. And as you can see, he's listening to the chest of a patient who's probably got tuberculosis. And in his left hand, I believe that's a very elementary stethoscope, which he used, which he was one of the first to use. And you can also notice that he's listening. He's listening for symptoms from the patient's chest. He's not listening to what the patient is telling him. He's listening to the patient. The patient is, according to some critics of the French revolutionary model, the patient is in a sense dehumanized, and he's reduced to a set of symptoms so that the patient doesn't define the disease so much as the disease defines the patient. And this is the start of the kind of medicine that was practiced until very, very recently, in which patients' subjective symptoms were held to be subordinate to the kinds of signs and signals that physicians were able to record examining patients. So René Laennec was one of the great pioneers of this French revolutionary model of clinical medicine. And as you can see, there's also, if you look at this picture, there's also a sense of deference on the part of the other healthcare workers, especially the nurses, and the nursing sister here on the right. And that, again, conveys the distinct impression that this physician is a man of authority, is a man of prestige, and he's somebody to whom you defer when it comes to these kinds of issues. There were other famous doctors of the 19th century who were responsible for some very impressive strides in experimental medicine. This is a picture of Joseph Lister, who is responsible for producing the first antiseptic approaches to surgery. In fact, you can see his assistant here on the right is actually spraying the patient with a kind of carbolic acid spray, which Lister intended to use to disinfect any kinds of wounds or openings in the abdominal cavity due to the surgery to prevent infection. Hospitals, during the rise of organized medicine in the 19th century, underwent important changes too. Hospitals for much of the early part of the 19th century were charity institutions where people who were exceedingly poor were sent, and very often they were sent not to be cured, but to essentially die. And so conditions in many of these hospitals were deplorable, not all, but some. And this picture from a muckraking New York newspaper of the late 19th century captures conditions in one New York hospital. And as you can see, the conditions are very unsanitary. And here is an illustration of a hospital ward in the early 20th century. And you can see, again, how far hospitals have come under organized medicine. Hospitals now are no longer charitable institutions where people go to die. They're places where people can go to and where they can reasonably expect to recover from their illnesses. So that's an important transformation that's linked to the rise of organized medicine as far as hospitals are concerned. Surgery, too, makes very impressive strides during the 19th century, thanks to, again, Lister's introduction of antiseptic methods, but also the introduction of anesthesia. Before the middle of the 19th century, most surgical operations were harrowing experiences. There was no anesthesia, short of a good shot of brandy, and very often surgeons were reluctant to perform surgical operations, especially on the abdominal cavity, because of the high risk of infection, the high risk of shock leading to death. And so surgeons tended to only operate in very, very critical situations. Well, with the coming of anesthesia and antiseptic methods, surgery as a specialty in medicine grows by leaps and bounds. And just to take a look at one aspect of surgical experience, childbirth, there's no doubt that these reforms improved the surgical experience for patients. There's no doubt that, for example, childbirth was safer because of these improvements in surgical technique. But at the same time, this helped to, these reforms in technique encouraged surgeons to become more, adventurous, more aggressive in using surgery as a way of trying to cure patients. And so if we go back to the example of childbirth, for an example, more and more women, of course, were delivered of their babies by surgeons between, say, 1850 and the early part of the 20th century. And yet the rates for maternal mortality and child mortality actually didn't decrease very much, despite the fact that more and more children were being born in hospital settings delivered by surgeons. Okay? So surgeons, there's an old expression that surgeons used to learn until very, very recently in medical school. They were taught by their surgical teachers the slogan, "When in doubt, whip it out." And that was pretty much the ethos of surgery until very, very recently. There was a lot of bravado about surgeons. They were viewed, and they saw themselves as the swashbuckling characters and who were pushing back the frontiers of medical care all the time. Well, that leads to, as I say, a certain element of recklessness and a certain element of adventurism, which, at least in this particular part of history, didn't lead to improved patient outcomes dramatically. Another sign of the rise of organized medicine was the rise of medical schools. And here you see a photograph of a fairly typical medical school near the end of the 19th century. Of course, you'll notice that all the students are men. Medicine during its rise and its professionalization in the 19th century becomes an almost exclusively male-oriented profession. Women are denied access to most medical schools, not all, but most medical schools, right up to and into the 20th century. As I said before, organized medicine established its own journals. And this is the symbol of the New England Journal of Medicine, certainly one of, I think it is the longest standing American, U.S. Medical journal, dating back all the way to 1812. There's the symbol for the American Medical Association. The American Medical Association is formed in the 1840s, I believe, when most other nationalities established their own national medical organizations, usually in the 1840s or into the 1850s. So the 1840s and 1850s were a time, again, of professional organization on the part of licensed physicians. Then we entered the age of miracle drugs. Excuse me, the age of miracle drugs, which begins in the early 20th century. And one of the great discoveries, of course, that medical research makes is the discovery of penicillin. And penicillin was proved to be extremely effective in curing a whole host of diseases. But again, I repeat, a lot of these killer diseases, a lot of the incidence of a lot of these killer diseases had been dropping steadily into the early 20th century before these miracle drugs were introduced. This is an interesting picture too, because of course it shows a physician serving in the medical corps in the Army, this being the American Army, and I'm assuming this is, well, it has to be World War II because penicillin wasn't discovered until after World War I. So this is a scene from World War II, and it shows, again, that physicians were not only out there in practice, operating in hospitals, but they also were serving the state. They were also serving the state in wartime, because of course we're talking about an era which features World War I, World War II. Both these wars saw the increased mobilization of the home front and increased mobilization of organized medicine. So many physicians served in World War I and in World War II, served in their respective national armies. They did medical screening, testing of recruits, but they also served, as this picture shows, on the battlefront, right at the battlefront. And there's another thing I'll point out about this picture too, because although I'll be mentioning it, I think, in a short while, and that is that it shows, again, the influence of the media. The influence of the media trumpeting the accomplishments, the exploits of modern medicine, and it's hard to understand the increasing prestige and reputation of organized medicine up to this point without taking into consideration the important role that the media play. And by the media, I mean newspapers, magazines, but also, of course, by the 1930s radio, and by the 1950s television. We'll be seeing an example of that in a short while. Perhaps the biggest achievement of scientific medicine was the discovery of a vaccine for polio by the researcher Jonas Salk. This was a discovery of the early 1950s. This picture shows a whole bunch of happy kids lined up having, I guess, just been vaccinated. And it's testimony to the fact that once the vaccine became available and it was shown to be effective, there were mass vaccination campaigns. And some of us, including myself, are old enough to remember the hullabaloo, the fanfare that surrounded the introduction of polio vaccines, because parents spent the spring of almost every year terrified that their kids would somehow get polio that summer. Usually it was felt from using public swimming pools. But the point I'm trying to make is that the polio vaccine was largely associated with modern medicine, and it helped to improve the doctor's image. And here you see a picture of Alexander Fleming on the right, the discoverer of penicillin. And doctors are frequently depicted in these in the media in the early 20th century wearing these white lab coats. Whether you're just a simple family physician or you're a researcher, you wear the white lab coat. And if you're a family physician, of course, the white lab coat says you're not just somebody who takes care of kids, you're somebody who has the mantle, who carries the mantle of science with you. This is a picture that dates back to 1891. It's a painting, a very famous painting, and it depicts a physician, of course, late at night, and interestingly enough, for those of us in this day and age, making a visit to the home. Doctors used to do this. And of course, he's examining a young child who is, from what we know from the background of this painting, who is dying, and the doctor there is studying the child. You can see the parent lurking in the background, distraught. This painting was meant to convey, again, that doctors weren't just scientists and weren't just skilled in research, but they were also compassionate. And they cared deeply for their patients. Now, one of the reasons I mention this illustration is that in the late 1940s, when there was a campaign to introduce national health insurance in the United States, the American Medical Association used this painting in its publicity, in its advertising, to try and convince the American public that if you opted for socialized medicine, you were introducing politics into what was a very personal relationship between doctor and patient, or in this case, doctor and the patient's family. So keep politics out of it was the theme that was applied to this particular painting much later in the 1940s. But again, this is typical of the kinds of depictions that you see more and more in the early 20th century, depictions of doctors. And again, for those of you who are old enough, you'll remember Dr. Kildare, who appeared on television in the 1950s. And this is a picture this is a still from the show, where you see Richard Chamberlain, Dr. Kildare on the left, and wearing his famous, of course, the ever-present white lab coat, and he's visiting a patient in hospital. Compare this with Dr. House in today's TV drama about modern medicine, because Dr. Kildare is clean-cut, terribly handsome, and he's a figure, again, of authority, science, and compassion. The word compassion is not one that I associate with Dr. House, but so there's important differences between the two images of the doctors. But again, by the 1950s, this was the image of the doctor. And so historians have depicted this time period, leading up to the 1960s, as medicine's golden age, when the medical profession and its institutions enjoyed very high public regard. As one observer said, patients in the 1950s were, quote, completely under the supposedly scientific yoke of modern medicine as any primitive savage is under the superstitious serfdom of the tribal witch doctor. In other words, patients trusted their doctors implicitly and without qualification. This was the typical, and of course you still see it in folks today, the high trust that they place in their physicians. The consensus then, circa 1950, was the more medicine society receives, the healthier it is. So the more you see Dr. Kildare, the better you'll feel, right? The better off you'll be. The higher your quality of life will be. The other part of that consensus is that practitioners, hospitals, researchers, and medical schools should run their own affairs as they see fit. In other words, that organized medicine should enjoy autonomy and freedom to supervise its own practices and its own institutions. Okay? But again, this is the important point. There is no evidence that the important improvements in public health up to the middle of the 20th century were due to any great progress on the part of organized medicine. The role of organized medicine was very small in the improvement, the general improvement of health and the extension, too, of life expectancy. Okay? And here's Brock Chisholm, because now we're seeing around the 1950s the first evidence of the globalization of the Western model of healthcare, the model of healthcare which, again, dates all the way back to the French Revolution and has become more or less established by the middle of the 20th century. We're seeing the globalization of that approach to medicine, and one person who was front and center in this important transition era was a man by the name of Brock Chisholm, who actually was Canadian, and he should be a lot better known because he played a very important role in the establishment of the World Health Organization. He was its first Director General from 1948 to 1952. And you see him here on the left in front of some posters put up by the WHO, the World Health Organization, which grew out of the United Nations. Chisholm was partially responsible for the World Health Organization's landmark definition of health, which is established in 1948, which says, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. What does this mean? Well, what it means is that the WHO has defined health, redefined health, as a virtually open-ended concept. What constitutes a state of complete physical, mental, and social well-being? How do you define it? How can you tell if you've achieved or attained this state of complete and physical, mental, and social well-being? Well, of course, you can't. So this definition has shifted the definition of health so much so that it's in the past, of course, if you were sick, you were suffering from symptoms, obvious symptoms of sickness or ill health, and so you knew if you were sick. Now, with this definition, health takes on this nebulous, very imprecise concept, and it really triggers then, or it helps to stimulate demand for more healthcare services. Yes, Ron.
It becomes infinite, effectively, right?
Yeah.
The need for healthcare becomes infinite.
Yeah, absolutely. Yeah, that's a good way to put it. So the need for healthcare becomes virtually infinite. And again, this is the World Health Organization establishing it. So it doesn't just affect healthcare in rich countries. It's meant now to apply to healthcare in poorer countries, in the developing world, in other words. Well, we've seen now the rise of organized medicine up to the middle of the 20th century, and now what we see is a remarkable series of events, what I would call a tremendous backlash, which begins to occur in the 1960s when you see the rise of countercultural movements attacking society's institutions, and inevitably organized medicine as one of society's most entrenched and powerful institutions, it too came under attack. What am I talking about when I talk about countercultural movements? I'm talking about the movements, for example, that assert rights for African Americans, for women, for gays, for Aboriginals, Chicanos, and so on and so forth. These movements characterized political life in the 1960s, especially in the United States. And this led, as I say, to attacks, the first attacks we really see on organized medicine on this scale and of this magnitude in all of history. There have always been critics of medicine over time, but never had so many critics been so vociferous and so numerous in one particular time. So medicine's paternalism, its independence, and its claims to expertise were attacked. And many of these attacks derived from the women's movement. And a key event in the women's health movement was the publication of a book called Our Bodies, Ourselves. In 1971, its first edition comes out. There have been many, many new additions since then. Some of you have read Parts of Our Bodies Ourselves, perhaps. So it was an important publication, and Our Bodies Ourselves taught women that they should educate themselves about their own health, that they should become familiar with their own physiology and with their own anatomy, but also demand greater accountability from their doctors. Assert their rights to informed consent. They stressed that women should be demanding a more egalitarian relationship with their doctors. And so Our Bodies Ourselves, as a symbol or a reflection of the women's movement, was an important event, this publication in 1971. Just a few years later, Ivan Illich's book, Medical Nemesis, was published. This is one of your readings I've asked you to do for this particular area of global issues. Here's a photograph of Ivan Illich. He passed away just a few years ago. I'll just go over some of the points that he makes in Medical Nemesis, which was published in 1976. Illich argued that the medical establishment was a major threat to health, that the damage done by clinicians, that is, physicians who treat patients, that the damages done by clinicians outweighed the benefits. He warned, too, that the dependence on costly, high-risk, those are his terms, medical health care was spreading from rich to poor countries. In other words, he was one of the first to warn about the effects of globalization of health care. Illich argued that the growth of organized medicine had impaired the individual's ability to heal himself. He introduced this term iatrogenesis, which essentially means caused by the doctor. So iatrogenic disease is a disease, an illness that's caused by a doctor. So, for example, if you go to the hospital, this is purely hypothetical, but if you go to the hospital, the Queen and you develop a staph infection, well, that is an example of iatrogenic disease. And Illich stressed this concept. He thought there were three main kinds of iatrogenesis. One was clinical, and that refers again to the damages that medicine inflicts on patients and on populations. The second is social iatrogenesis, which he claimed destroys people's autonomy and breeds demand for the patient role. In other words, the growth of medicine encourages people to want to adopt the role of patient, that there's something rewarding in that, and not just in terms of your overall health, that it confers a kind of dignity or confers a kind of respectability on you. And then he referred to structural iatrogenesis, and this he called the paralysis of healthy responses to suffering. And I think one of the good examples of this might be the whole debate over euthanasia, which we'll get to in a minute. So these are some of the most pivotal points that Ivan Illich makes in Medical Nemesis, and which I'm sure some of you have recognized from your own reading. At the same time, we're seeing the rise of the diseases of lifestyle and old age after the middle of the 20th century. One of the signs that life expectancy is increasing, that people are living to older ages, is the increase in the incidence of cancer. And here you see a photograph dating from the 1940s, depicting the kinds of campaigns that were launched by governments and organizations, health organizations, against cancer. Campaigns designed, of course, as we know, even in our present day, to raise funds for cancer research. and very often governments, including the government of President Richard Nixon, resorted to these kind of militaristic metaphors to depict the campaign to try and stem the incidence of cancer. And so very often you heard talk coming out of the White House during the Nixon presidency of a war against cancer. This is an interesting ad. This is an old ad from the 1940s for tobacco products, for smoking. And what you see is that in this ad, even doctors were promoting the use of cigarettes. But mainly what I wanted to point out was that smoking was very acceptable up to the 1960s and 1970s. And of course, this is a good example of how lifestyle actually affects overall human health. Again, getting back to the whole point about public health. Eating, of course, eating habits in the late 20th century have changed, if only with respect to the growing reliance on fast food. And of course, this has had the usual effects, the understandable effects on health, rise of obesity, diabetes, and so on. Another sign of the changing times is the foundation in 1958 of the American Association of Retired Persons. Now it's simply called AARP. That's still going on. It's one of, if not, the most powerful lobby groups on Capitol Hill in Washington. So it's a very, very powerful organization. And again, it's reflective of the fact that the population is aging in the late 20th century, and that as more and more people are aging, they see themselves then as a distinct social group which has its own interests which need to be defended in the corridors of political power. And you also see, of course, as people are aging and people can now reasonably expect to live longer lives, they want health care, and this leads to the first signs of the first efforts to introduce national taxpayer-funded public health care. This is a picture, of course, of Tommy Douglas, the former premier of Saskatchewan, who introduced the first, really, the first system of national health care, in this case provincial health care, back in the 1940s. And that was followed very closely by the establishment of the British National Health Service. And of course, very recently, President Obama's groundbreaking, in terms of American history at least, groundbreaking legislation providing subsidized health care for most Americans. So the arrival of these kinds of systems of health care, again, are reflective, I think, primarily of the demand for more health care on the part of a population that now can expect to live longer and wants more health care, presumably because it makes the quality of life better. There's also a contraceptive revolution that goes on. And here it gets to an important point I will make in one of my conclusions, and that is that what we're seeing now with medicine in this period is we're seeing it become a technology all of its own. You'll remember some of the comments that Professor Germain made about technology as being less an array of products and services and more as a process of mastery and control, which and this process of mastery and control aims to control all the contingencies of life, all the uncertainties of life. And of course, we see this with the coming of the so-called pill, the oral contraceptive. There's a contraceptive revolution, and again, it's largely because people are demanding more and more, especially women, of course, they're demanding more and more control over their fertility. And I'm not saying this is a bad thing. I'm simply saying it's part and parcel of this transformation in society in the late 20th century, which stresses, again, medicine as a form of technology and as a technology, I should say. A better example, perhaps, of what's going on in healthcare in the late 20th century is the rise of the debate over euthanasia or the right to die. And it gets back again to the aging of society. Again, as more and more people are living to ripe old ages, they're beginning to experience the diseases of old age, the infirmities, the disabilities, the handicaps of old age. And this, it's not the only reason why there's rising demand for the legalization of certain forms of euthanasia, but it's certainly one of the crucial reasons why, first of all, we have a debate over these kinds of things, and why polls tell us that when people are surveyed, they say they prefer, that substantial majorities say they wish that people had a right to die, a legal right to die. In other words, some kind of, again, mastery and control over your end-of-life experience. And this applies to the different forms of euthanasia, whether it's physician-assisted suicide, which of course we were debating in this country just recently, as this past spring, I believe, over legislation before the House of Commons, or other forms of end-of-life care involving mercy killing and other medical treatments, or medical, I should say, procedures. And here you see a picture of perhaps the most familiar face of the Right to Die movement, Dr. Jack Kevorkian, nicknamed Dr. Death. But again, if you look beyond all the fanfare and the hoopla surrounding this particular debate, what it is essentially, again, a reflection of the important changes that are going on in medicine, healthcare in the late 19th century, and especially about the way the public, the broad public, views its relationship with medicine. There's the sexual revolution. And these two people were very familiar faces back in the 70s and 80s, the sex researchers Masters and Johnson. And again, their research into human sexuality, so the press told us, and again you see Time magazine and the media and their involvement in this, the press told us that researchers such as Masters and Johnson were overturning the old taboos and old myths about sexuality and so on, and certainly they did challenge some of those. But again, I think the important thing about the rise of the sexual revolution was that it turned sexuality into another aspect, a very personal life, private life, that had to be mastered and controlled. That technology could in some way change it radically so that, again, all contingency, all unhappiness, all suffering could be eliminated. So it introduces very much so, Masters and Johnson stressed that a key to healthy sexuality was one's performance as a sexual being. And again, this stresses the notion of the performance principle. And when we look at the sexual revolution, the contraceptive revolution, when we look at the debate over euthanasia, what we see is an interesting transformation. What has happened here? In only a few short decades, perhaps the three most important yet private aspects of life, birth, sex, and death, have essentially been medicalized. They've been redefined as medical experiences. They've been redefined as human experiences which can only be studied properly by scientists, and that we should always refer to physicians or licensed experts if we want to understand how we are to have healthy lives in all these three areas of human experience. So that, I think, is a vital transformation that's occurred. So this brings us to my conclusions. From looking at the history of healthcare over the last 200 years, I think we can draw certain conclusions. And number one is that today's crisis in healthcare coincides with the rise of what I would call a culture of consumption. And by that I mean another interesting transformation. A transformation which occurs over the second half of the 20th century. And this transformation sees patients being transformed into consumers. This is due to a variety of things, such as the rise of the consumerist movement, and the important role that Ralph Nader, among other consumer advocates, plays in recent history. But that's an important transformation because now people don't see themselves as patients, in other words, as kind of passive recipients, I should say, of medical care. They see themselves as consumers of healthcare services and products. And just as we see in other fields of consumerism, that too is an open-ended concept. Because how many, for example, how many cars do you need? How many houses do you need? Well, you know, if you've got the money, you keep buying and buying and buying. And the same thing, I think, applies to the ethos of consumption or consumerism that dictates modern healthcare today. And that's the point I'm trying to make, that the rise of the culture of consumption over the last part of the 20th century coincides with this crisis in healthcare. And in fact, more than coincides, I think it helps to explain largely the out-of-control costs, especially, that our healthcare economists are complaining about time and time again. Second point, medicine is technology. I've mentioned this more than once. I'll repeat it. Medicine at the end of the 20th century is viewed as a process, viewed as technology as, again, a process that leads to mastery and control. But interestingly enough, without a belief in progress, and this is an important point, it's not so much that we consume the products of medicine as technology because we actually really believe we're getting better and better, because we don't seem to believe anymore in this notion of progress. It's almost an absurd undertaking. And it's due, again, to this notion that we are addicted to technology. For example, the Right to Die movement, which is based on the idea that, yes, there are end-of-life things that doctors can provide you with which will minimize your suffering, but also restore your dignity. And that's, again, another example of what I'm talking about when I talk about addicted to technology and its products and services. I would go further and say healthcare today is in the grip of the law of diminishing returns, because the more we spend on healthcare and the more healthcare we get, the unhealthier we actually become. And this is translated into, as I mentioned before, the notion of therapism, the dependence on professional help to live day to day. I'll be talking more about this in my next lecture about the quest for mental health. But it's worth pointing out that therapism has affected the history of the rest of medicine, the non-mental part of medicine, so to speak. Globalization. Globalization threatens to spread our approach to healthcare to poorer countries, and I think that Jean Mitchell will be talking about this in her lecture as well. I was reminded listening to Dr. Germain talk about the French philosopher Baudrillard, and I was reminded of what he had said when he said that reading Baudrillard forces us to sort of slow down. In other words, slow down and think, take stock of where we are and what technology is doing to transform our lives and where our lives are headed. I think in the same way, Ivan Illich, even if you don't agree with him, and certainly there are some very bold theories that he puts forward that you may not agree with, he at least forces us to ask important questions about the state of healthcare today. And remember, he was writing this in 1976, which is, 30 some odd years, almost 30 years ago. And yet he was one of the very first, if you read that section in your reading, he's one of the very first, again, to warn about the actual effects of globalization, the export, in other words, of our Western model of healthcare. So I think Ivan Illich, again, forces us to slow down and to take stock of where we are and, again, what we could perhaps do as private citizens to deal with this issue. Let me just put a plug in for history here, okay, at the very end, because obviously what I've done is I've tried to give you an historical perspective on the state of healthcare today and how we got here from there back in the late 18th century. I think history shows that it was far easier to get into today's policy crisis than it will be to get out of it, because there are so many people with so many vested interests, not just as patients, but people working within the healthcare industry. There's so many vested interests that any kind of reform of the healthcare system today will be wrenching, will be difficult. Doesn't mean we can't undertake it. We shouldn't try and undertake it, but it will be difficult because, again, a lot of people have a stake in the system as it is today. So history certainly shows that the challenges facing us today are daunting, to say the least. The study of history, and this applies to the history of healthcare, reminds us, and by that I mean it requires that we become conscious of something that we, and by we I mean as a society, as a culture, already knew. I mean, all you have to do is talk to your grandparents about what healthcare was like. All you have to do is to talk to them about what it was like before the introduction of, before all these great changes that we've witnessed in the second half of the 20th century. We're aware of these things, we just don't think about them. And the act of reminding, the act of historical reminding, I think, encourages us to think about something that we thought we knew, but yet in a new way. And by that I mean things like progress, technology, health, and well-being. So again, to summarize, I think history enables us to think about these things in new ways, and as such, I think it helps us to recover the political will we need to make the changes necessary in future. So, thank you very much.